My name is Brandon Omernik. I'm a certified tobacco treatment specialist with Hutch Cancer Center. One thing I always try to highlight anytime I'm discussing our program is that it's like this incredible resource where it's no cost, provide as intensive counseling as patients in need. So if they need to meet, we kind of discuss their goals, their quit attempts. We also provide no cost nicotine medications, so patches, lozenges, and gum. We kind of got the access to all of these awesome tools. This Quit to Heal app, which was like tailored for patients with cancer to help them stop smoking. So if a person doesn't want to interact one-on-one with a counselor, we have those resources available. So we don't consider tobacco cessation as a one-size-fits-all approach, but what we do is we have sort of a stepped care model approach to tobacco cessation. So step one, as I mentioned, is beginning by identifying everyone who uses tobacco products. And how we do that is whenever a new patient comes in, we ask that they have their tobacco use history documented. So a simple question like, have you used a cigarette in the past 30 days, even a puff? When we document that, we're able to identify how many people currently use tobacco products. And then we can also introduce our program at that point. We say, hey, we have this great no-cost program for you if you're interested, or we have these other resources available like the QuitBot app or Quit to Heal. And we can also kind of help people identify external resources if they don't want to work with us. But what a patient who does want to work with us will happen is that we create a referral to our program where they're on board and they meet with us we set an hour-long kind of conversation, helping identify what their personalized plan is for quitting, kind of do some skill-building exercises, identify medication, treatment options for that patient, and then we have that no-cost nicotine replacement medication, which is a huge benefit. And then the last step is that we work with healthcare providers to get access to prescription pharmacotherapy, help that patient work with their healthcare provider, kind of build that relationship around their goals of tobacco cessation, because we know it sort of impacts all aspects of cancer care between treatment outcomes, certain just quality of life and pain management. So I think it kind of empowers the patient to sort of say, here's an aspect of my care that's within my control, and how do we kind of be the stewards of that empowerment. First baseline, I would say, as a top tip for people who are interested in quitting is understanding that tobacco or nicotine dependence is similar to a chronic disease the way diabetes management is, or asthma. We don't talk about somebody who is managing their diabetes as they quit diabetes. You ended up with the skills, you ended up with the medications to be able to manage it over time. And that's how we treat tobacco dependence. And we also kind of view that as it's going to take sometimes multiple attempts. In a best case scenario, somebody gets the right plan, has the right team around them, and the right support. But knowing that just because it didn't work one time doesn't mean it's not going to work the next time. The next step in that is that we also kind of recommend a combination medication approach for our patients. So our program, what we do is we provide the nicotine patches, gum, and lozenges. We recommended using the patch with either the gum or lozenge. I think a lot of times people have maybe had an experience using the patch or using the gum in the past and said, well, that didn't seem to work for me, but we can kind of fill the gaps using those other medications. I often describe the patch as like it works in the background. It's this reliever medication that controls cravings. And then you use the lozenge or gum for these sort of breakthrough cravings, maybe really strong habit-based ones if it's waking up in the morning, getting in and out of the car, finishing work, kind of preparing for those and using the nicotine gum or lozenge at that time. And our program really looks at what are FDA-approved medications and what are recommended by National Comprehensive Cancer Network guidelines. And there's 7 medications that are FDA approved. The first 2 are prescription options, which is bupropion, varenicline, the name brands are like Wellbutrin or Chantix. Those are the medications that, working with your healthcare provider and setting a goal around quitting, are extremely impactful and have a really great cessation rate. And then the other ones are like a nicotine nasal spray, there's control inhalers, which aren't really available, and then the patches, gum, and lozenges. All of those medications we recommend using over something like an alternative such as vaping, purely just because, one, we have evidence on their safety, we have evidence on their efficacy. The last part is that the nicotine delivery through these medications is a much safer alternative to inhaling nicotine, where it's absorbed so fast. Modern e-cigarettes or vapes are kind of developed to mimic the way cigarettes impact our lungs and how fast that nicotine is absorbed. So even a person who had success quitting cigarettes by using an e-cigarette alternative often still is dealing with those increased cravings throughout the day and feels like, I would like to be able to manage those better. One thing that I'm really passionate about is working with our government and community relations team, which is awesome here at Fred Hutch. So I represent Fred Hutchinson Cancer Center in Washington Breathes, which is a statewide commercial tobacco coalition for the state of Washington. Our government and community relations team kind of helps us address tobacco-related policy issues, such as flavors or kind of advocacy for prevention, especially with like youth. It allows you to sort of be able to take some clinical experience and adapt that at scale for our state. So really enjoy working